Hi, my name is Kori Dewing and I'm a nurse practitioner at Virginia Mason. I work in rheumatology and I've been working in rheumatology since 2003 when I first graduated from the University of Washington with my master's. I went back to the University of Washington and graduated as part of the second cohort. I graduated in June 2011 with the DNP and have continued my work in rheumatology. As part of the program for the DNP, there is the capstone project, and shortly after realizing or learning that I needed to develop this capstone project, I met with some of the leadership at Virginia Mason and asked them what would they be most interested in that fit within my area of interest, particularly in osteoporosis or bone health. And they gave me some ideas at that point, and I went back to my doctoral committee as well as met with other folks within Virginia Mason, such as the IT department, and we developed through various meetings a data strategy of looking at a clinical decision support tool that had been developed a few years earlier to help recognize which patients needed bone density screening. And we wanted to know whether or not that bone density screening tool that popped up was effective, if it improved the rates of bone density screening in a particular population. So it was with working within my department as well as with the leadership of Virginia Mason that I developed this research question, looked at this particular question through IT so that we could get the data and then evaluated it. And since that time, since the results have come out, I've been able to share what we learned with the leadership here at Virginia Mason, which has been exciting for them as well. So it's really been a win-win situation for both the facility where I work as well as the University of Washington and myself as I finished my degree. Before I went back for my doctoral program, I was involved in quite a few leadership activities. Finishing the program has certainly built on those skills for me, and I still am involved on a national level, starting to improve education of rheumatology, nurse practitioners, and PAs throughout the country, which is a real area of need, as we've discovered. Also, I find that having the training that I have has enabled me to look at my daily work, what I do every day, and approach it with this interest of lifelong learning, of lifelong change, of practice change. How can I make things different? It's given me the tools to be able to look at my practice, understand some of the things that happen behind the scenes, get a better understanding of what happens with IT, what happens in our electronic medical records, how we can gather data, what does that data mean, what we can do with that data, and I think that that's been the real strength of going back and finishing this program for me. I finished my master's program in 2003 and started working in rheumatology shortly after graduation. At that time, there was already talk about this program, so I knew that it was potentially coming up in the future. When I saw that the DNP program was announced, I thought perhaps that might be something I was interested in. At the time, I was already involved in leadership in rheumatology at local as well as national level, and I thought going back to the University of Washington, doing the DNP, knowing that this was going to be the practice entry requirement in the future would be something that would be needed for me if I wanted to continue at the level that I was practicing. I also knew that the University of Washington was the #1 ranked nursing school in the country, so that was certainly an advantage for going here, as well as being a resident working in Seattle. It was a natural fit for me. The faculty have been very supportive, and I've known them because I went here for my master's as well. So came back to school, did my DNP, and the nice thing is that I was able to live. I was able to work. I was able to have 2 children during the program, and although it took me several years to complete the program, it was doable given my work and family life, which I think a lot of people are apprehensive about going back to school, because how can you fit something else in your lifetime?